Hi, everybody. I'm Dr. Brian Ardis, host of the Dr. Ardis Show, and this is a very special podcast presentation all on the natural ways to overcome depression disorders, all naturally. So that's what we're going to be addressing here. I hope you're having an incredible day. Thanks for spending time with us. I'm going to actually be walking you through a PowerPoint presentation over what the conventional medical definitions of depression are. I'm going to actually show you and define for you what are the various types of depressive disorders that are known to medicine and diagnosable and treated by traditional medical means, primarily prescription medications. I'm then going to show you a few of the most commonly prescribed medications for depression disorders and some of the most horrific side effects. I'm going to show you what's published. And then I'm going to walk you through what are just a few. I'm actually only going to show you 4. I'm going to show you 2 vitamins. I'm going to show you a mineral and an herb. I'm going to walk you through those and how they're published to actually help improve the depressed states of the mind in human beings in medical research studies. So hang out with me. I'm going to walk you through depression disorders, natural solutions right here today on the Dr. Ardis Show. So I hope you're ready to learn, and I'm excited to present. So like all of our PowerPoint and podcast presentations, I'm going to be showing you a PowerPoint presentation we have built. So the PowerPoint is now on the screen. I'm going to walk you through this PowerPoint, showing you everything I'm actually wanting you to learn, what I have learned and what we put together as a team here at the Dr. Ardis Show. All right, so overcoming depression disorders naturally is the title of our PowerPoint. Remember, you can get this entire PowerPoint for anybody you know dealing with depression, which are millions in America and around the world. If you or a loved one suffers or struggles with depression, which I'm about to show you the definitions of, you can remember to go to the drardisnicotine.com, the resources tab, and download this PowerPoint. It is there in the resources tab titled Overcoming Depression Disorders Naturally. Download it, email it, send it out, print it, save it, take notes. And now you will have the recommendations I'm showing you medical research has already proven. And then if you have loved ones that are on the medications I'm going to show you, and you're worried that they may not know these are side effects of those things, and maybe they're struggling with some of these things even while being treated for depression, you might want to make them aware that you just learned here, the Dr. Ardis Show, that these are published side effects, and maybe they should know. All right, so here we go. Scan the QR code if you would like to get notified in the future. If you're a stranger or newcomer to the Dr. Ardis Show, or you have been sent this podcast by a loved one or a friend, scan the QR code, put in your email, and we will notify you of our once-a-week podcast where I walk audiences through what is currently defined in the medical profession as either a cause of a health disorder, the known treatments for the disorders medically, what are some of those risks, and then the natural solutions is always the focus there. All right, so let's first define what depression is. So depression, when you go to Webster Merriam Dictionary, or the Merriam-Webster Dictionary, it is defined as a mood disorder that is marked by varying degrees of sadness, despair, and loneliness, and that is typically accompanied by inactivity, guilt, loss of concentration, social withdrawal, sleep disturbances, and sometimes suicidal tendencies. The Cleveland Clinic defines depression as a common mental health condition that causes a persistent feeling of sadness and changes in how you think, sleep, eat, and act. The Cleveland Clinic goes on to define what are various types of depression. So this is straight out of the Diagnostic Statistical Manual of Mental Disorders, 5th edition. For those of you out there who are health professionals, DSM-5 is what you know it to be called. All right, clinical depression, in parentheses, major depressive disorder. I'm going to read these to you, but you'll see highlighted statements in red for all newcomers and those of you who are here. I'm going to be focusing primarily on any red outlined, underlined statements on everything I throw up here. But a diagnosis of major depressive disorder means you've felt sad, low, or worthless most days for at least 2 weeks, while also having other symptoms such as sleep problems, loss of interest in activities, or change in appetite. This is, the Cleveland Clinic says, and the DSM-5 says, this is the most severe form of depression and one of the most common forms. So clinical depression is defined as a 2-week period where you feel sad, low, or worthless most days. Now, I have a problem with this diagnosis, by the way. What if you were married for 20 years and then just found out you were served divorce papers? Don't you think you'd be depressed for 2 weeks? How can this be a clinical depressive diagnosis? You ever lost a job where you're not sad for 2 weeks? Did you ever lose a dog? I bet you were sad for 2 weeks. Okay, this is the absurdity of this diagnosis, by the way. So a 2-week period of feeling low and sad and worthless can allow you to be clinically diagnosed as depressed. Ask me how I really feel about that. The next is persistent depressive disorder, abbreviated PDD. Persistent meaning longer than 2 weeks, I bet. Persistent depressive disorder is mild or moderate depression that lasts for at least 2 years. That is definitely longer than 2 weeks. All right. Oh, wait, let's go back. The symptoms are less severe than major depressive disorder, which is the one above. All right, let's keep going. Disruptive mood dysregulation disorder, abbreviated DMDD. Dysregulation disorder. DMDD causes chronic, intense irritability and frequent anger outbursts in children. And those symptoms usually begin by the age of 10. Premenstrual dysphoric disorder is another form of depression, abbreviated PMDD. Premenstrual, you can just guess this is before your menstrual cycle and never given to a man, this diagnosis. These symptoms improve within a few days after your period starts, but they can be severe enough to interfere with your life. Depressive disorder due to another medical condition. So they're telling you there's other reasons why this could happen. Many medical conditions can create changes in your body that cause depression. And some examples include hypothyroidism. Yeah, because your hormones are now off, including serotonin. Heart disease can lead to depression. Well, if you were diagnosed with heart disease, wouldn't you be depressed? For 2 weeks at least? That you're able to be clinically depressed. All right. Also, have you looked up the most commonly prescribed drugs for heart disease? Most of them include a psychiatric side effect of causing depression. Parkinson's disease and cancer. Did you know that the drugs commonly prescribed for cancer and Parkinson's disease also have published side effects of causing depression? But it's also depressing to be diagnosed with Parkinson's and cancer. Notice they didn't tell you anybody's diagnosed with elation when they're diagnosed with cancer, Parkinson's, and heart disease. Of course, it's depressing to have any of those. All right. Then they tell you there are also specific forms of major depressive disorder, the first one we just discussed. Seasonal affective disorder, seasonal depression. This is typically during the fall. This is a form of major depression disorder that typically arises during the fall and winter months and goes away during the spring and summer. Yeah, why? Because you don't have sunlight. Vitamin D deficiency is the #1 cause for seasonal depression, called seasonal affective disorder. Sad. It's very sad to be sad. All right, prenatal depression. This is while you're pregnant. And postpartum depression, after you're pregnant. Also another form of depression that should never be given to a man. Prenatal depression is depression that happens during pregnancy. Postpartum depression is depression that develops within 4 weeks of delivering a baby. And we're all familiar with postpartum depression, I'm sure. Now, here is from clevelandclinic.org also a summary infographic of the various symptoms of depression, and they can vary slightly depending on the type and the range of mild to severe. In general, those symptoms include, as you see there, low energy. See the man with his head on the desk, feeling very sad or hopeless. Had a hard time reading that word. Thoughts of self-harm or suicide, irritability, changes in eating behavior, sleep changes, loss of interest in hobbies and activities, difficulty concentrating or making decisions. You've all heard of Gallup polls. I don't know if you guys have ever been polled by Gallup, but I find this interesting. Every time they say people were surveyed or there's been a poll, I'm like, how come I've never been asked to fill out a poll or a survey? Where do they get these people to fill out these surveys? All right, Gallup poll. Here's a Gallup. High depression rates reach new highs. This is for America. All right, so they're looking at from 2015 to 2023. I just want you to watch. These are the trends. The first, just to identify, the first is the green line at the top on the graphic. The one below that is the blue line. Blue means, yes, I'm currently depressed. The green line is, yes, I have had lifetime depression. Okay. Notice the percentage of people, 29% reported, yeah, I've got lifelong depression, lifetime depression. Really? Okay. The 17% are reporting, I'm currently depressed of those they interviewed. All right, depression statistics. There's a lot of people that are affected by depression. I am not one of them, thank God. You want to know why I've never been sad for longer than 2 weeks? Just kidding. I have had periods where I was sad for longer than 2 weeks. I'm glad I didn't go get diagnosed with depression and put on the drugs I'm about to show you as a result of my 2 weeks of sadness. All right. Who is affected by depression? An estimated 21 million adults in the United States had at least one major depressive episode. This number represented 8% of all U.S. adults. It's almost 1 in 10. The prevalence of major depressive episode was higher among adult females. 10% were females, 6% were males. The prevalence of adults with a major depressive episode was highest among individuals 18 to 25. What is commonly done for those with depression? All right, antidepressants. Antidepressants are a commonly prescribed medication to treat depression. This is per the Cleveland Clinic and other mental health conditions. They ease symptoms like low mood and fatigue, but they don't treat the direct cause. I repeat, antidepressants per the Cleveland Clinic do not treat the cause of depression. Okay, so just want to remind all of you, even the medical profession knows antidepressants do not treat the cause of depression. In fact, I'll put it another way. You are not depressed because you are low on an antidepressant or you're deficient in an antidepressant prescription drug. Even the medical profession knows that's not what causes depression. So my next question for you is, what's causing you or your loved one to be depressed? Because it isn't a lack of antidepressants. But even if you were put on one, the Cleveland Clinic wants you to know you may notice improvements in 4 to 8 weeks. So it isn't overnight. It'll take 2 months for most of you to even feel anything. Depression is the main reason people take antidepressants. No kidding. These medications may reduce symptoms like emotional changes or fatigue, but they want to repeat again in this article, but they don't fix the root cause of depression, which is what we're going to dive into on the backside of this. So just remember, the medical profession passing out antidepressants like they're candy to millions of Americans, that is not what's causing you to be sad, low. That's not what's causing you, is the lack of the drug. All right. This is from verywellmind.com. Common antidepressant medications. The most common, they tell you, are SSRIs, SNRIs, TCAs, MAOIs. And atypical antidepressants are part of this list of common depression medications. So those are their abbreviations, what you've commonly heard. SSRIs are the most common. Stands for serotonin reuptake inhibitors. Prozac belongs to a class of antidepressants called SSRIs, and they break it out for you. It means selective serotonin reuptake inhibitors. It blocks the ability of brain cells to absorb serotonin, your feel-good, happy hormone. And they think that if they can block your brain's ability to absorb the limited serotonin that you have, if we could just get the body to build up in the brain more serotonin, maybe this person will feel better. SSRIs, they say, relieve depression by boosting low levels of serotonin in the brain. They do not do anything to your serotonin levels. You just can't absorb and use serotonin the way you were normally. And as your body's not using it, it's going to get built up. Oh, and just so y'all know, the majority of serotonin is made in your gut, by the way. So this is why the gut-brain connection is so important. If you're depressed, you might want to look at what you're putting in your gut. One study looking at people treated with antidepressants in the United States between 1996 and 2015 found that nearly 70% of respondents were treated with SSRIs. So of all the drugs listed above, SSRIs, SNRIs, TCAs, MAOIs, they tell you 70% of all people between 1996 and 2015 actually were put on SSRIs for depression. That makes SSRIs the most popular drugs for depression. And I'm about to show you what the problem is knowing this. Okay. Prozac, otherwise generic name is fluoxetine. These are some of the most commonly prescribed SSRIs. We're going to focus on these because they represent, for that period they just showed you, 70% of all antidepressant drugs are SSRIs. You might as well know what 70% of the world's being told to take. Prozac is still one of the most popular SSRIs in the US. It's one of the only that the FDA has approved for children and teenagers, and is approved to treat major depressive disorder, the most common type of depression. It also is used to treat obsessive compulsive disorder, which you're going to be shocked what I'm about to show you. Did you know Prozac is published to cause OCD? What? And sometimes bipolar disorder in children 8 and older. Whoa, 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 whoa. I'm not sure being depressed, sad, lowly for 2 weeks and giving them a drug that makes 8-year-old children and older to become bipolar. Do you know what that means? Did you know hallucinations can be a part of bipolarism? I'm not sure that's better. Celexa, citalopram is the generic name. Celexa works as well with other SSRIs. Zoloft, the generic name is sertraline. Zoloft is highly effective, they say. Zoloft is the most common depression medication. Did you know that? So of all the SSRIs, Zoloft is the most common depression medication. Paxil, generic name paroxetine. You might be more likely to have sexual side effects. I want you to know about that one. And then Lexapro. Lexapro is one of the only SSRIs they state approved by the FDA for children. It is indicated for use in children and teens between the ages of 12 and 17 years old for the treatment of major depressive disorder. Now, you saw stars next to Zoloft, Prozac, and Lexapro, and we're going to highlight some of those. We're going to walk you through what is published by the FDA and the drug makers of each of the 3 most commonly prescribed SSRIs for depression. That represents 70% of all the drugs for depressed people in America for decades. I'm going to show you what their disgusting published side effects are that you should know about if your loved one is on any of these. All right. Or you yourself are on it. Prozac. Now, just so you know, it can't be that most people following the Dr. Ardis show are on these antidepressants because we try to keep everything happy and lively here. This isn't a depressed venue. We're not like the news. People on these drugs like the news because it's sad, stressful, anxious, panicking, wears you out, cortisol. All right, let's dive into this. Prozac, brand name fluoxetine. Okay, there we go. Go to the bottom. What is Prozac? Prozac is an SSRI antidepressant. That's what it can look like. I want to read to you the side effects. Now, when I read this to you, I'm going to go back to the Cleveland Clinic here in just I'm going to take you back to the verywellmind.org article right after I read this to you. I'm going to show you some highlights to remember from that verywellmind.org article about Prozac. This is what we're highlighting here in red box is the FDA black box warning for Prozac. The FDA's black box warning is the highest risk side effect everyone should know about before you start taking this. All right. SSRIs, they tell you, including Prozac, on the package insert reads, drugs.com, we're quoting, antidepressants can increase the risk of suicidal thinking and behavior in children, adolescents, and young adults with major depressive disorder. Closely monitor patients of all ages for clinical worsening and emergence of suicidal thoughts and behavior. Okay, stay there. They're telling you antidepressants like Prozac can increase the risk of suicidal thinking and behavior in children, adolescents, and young adults. Stay there. This is the warning from verywellmind.org, if you remember. Prozac is still one of the most popular SSRIs in the United States. It's one of the only ones that the FDA approved for children and teenagers. Hold up. Did you see this? The FDA is telling you when you put children and adolescents and teenagers on Prozac, which we approved, the FDA, they also published, you, mama, daddy, you better watch this. Medical doctor, you better pay attention and warn your patients. Watch when we give Prozac to your patients. It can increase the risk of suicidal thinking and behavior in children, adolescents, and young adults. You're welcome. That was worth the whole show here right now. At least you now know. Do you know anybody who's been put on Prozac and then started wanting to hurt themselves, kill themselves? I hope not. All right. Now we're going to go further into the drugs.com article, which is a summary of the FDA's disclosed and the manufacturer of Prozac's side effects. And we're going to focus on the psychiatric effects here, and we're going to dive into more. Because you're being prescribed Prozac and these other drugs I'm about to walk you through, Lexapro and Zoloft. I'm going to show you what are their published side effects psychiatrically and rest of the body. All right. Remember, this is being prescribed. 70% of all people are on this drug for depression. 70% of them are on these SSRIs I'm about to walk you through, 3 of them. And they publish, these are known side effects. Look at this. In the very common psychiatric concerned side effects that affect the psyche of the depressed person you're giving this drug to. Up to 33% can develop insomnia from Prozac, meaning they won't sleep through the night. That's 1 in 3. Does that help with depression? No. Or fatigue? No. 15% will increase their anxiety. Okay, great. Well, if you're depressed, do you want to feel anxious too? Nervousness will be up 14% of the time. This is the statistics from the trials, the human trials with Prozac. Another look at common. Up to 10% of all people on Prozac, 1 in 10 will develop abnormal dreams and personality disorders. What? Okay, I don't think that's a good idea. Notice the last one in there, thinking abnormal. I don't know. What does that mean? Look at hostility to the left, right before hypomania, low activity or function. Let's go down to the bottom. Frequency not reported and post-marketing reports are after the FDA approved this drug, and they're not keeping track anymore of what percentage of people are having these side effects. This is just what's being immediately reported by medical doctors prescribing Prozac after it went to market, approved by the FDA. So you won't see a percentage. Activation syndrome, anger, complete suicide. Okay, everybody out there, do you know that when you go on Prozac, it is reported by medical doctors around the country, when we started prescribing this FDA-approved drug, our patient completed suicide. Do you know what that means? That means they tried to kill themselves and it worked. They actually did kill themselves while on Prozac. And Prozac was to blame. Notice next, after complete suicide with Prozac, depression. Okay, did you know that they prescribed Prozac for depression? Did you know Prozac is published to cause people to be depressed? Depression, suicide is the next one. What? Nightmares, self-injurious ideation, hurting oneself and behavior, wanting to hurt others, hurting themselves. Intentional self-injury. I cut myself with a razor blade. I stab myself and poke myself to bleed just to feel pain. That's intentional self-injury. You know you're about to hurt yourself and you want to anyway. That's Prozac does that. Look at the last one, suicidal ideation, where people were not thinking about killing themselves before. We put medical doctors were reporting back to the FDA. I put my patient on Prozac and now they're thinking about killing themselves. And then look at the last one at the bottom. Medical doctors are reporting their patients were never violent before, and now they're exhibiting violent behavior from Prozac. Now, just so you know, I've already done this before on school shootings. For the last 55 years, every recorded school shooting in America, they only had one thing in common, and it wasn't guns. It was prescription drugs for antidepressants and anti-anxiety drugs. They were all on prescription drugs that affect the mind, and all of the drugs have violent behavior listed as a published side effect, just like Prozac. The nervous system, they report Prozac's published side effect, the very common, if it's over 10% of the time in clinical trials, over 10% of all people had this problem. They call it very common. So 21% reported headaches. Well, 1 in 5 people are going to develop headaches. Do headaches make people less depressed? What? No. Somnolence, that is not engaging socially, physically, like going out and doing anything. You're just in a chair, picture, I don't know, somebody after had their Thanksgiving dinner and they're sitting in the recliner and they passed out while the football's on. They're not engaging with the family. Somnolence. Tremors, and up to 13% of all people. Parkinson's, anybody? Anybody like tremoring? Does anybody think these tremors are good ideas? Dizziness, and up to 11% of them. Oh, wait, did I miss any? Hold on. Oh, let's go down. Keep going down. All right, listen. After the FDA approved Prozac, notice coma is a published side effect. After MD started prescribing it, some people reported back to the FDA, I gave them Prozac, they went into a coma. Okay. I don't know, is a coma better than depression? Then keep going down there. You'll see cerebrovascular accident. That is a bleeding stroke in the brain, everybody. Or a stroke, a blood clot in the brain. And then movement disorders. Okay, what the hell does that mean? So Prozac causes movement disorders. Well, I can tell you what that means. That is, picture Parkinson's, the involuntary tremors, and the gait issues. That's what this is. And look at that, worsening or pre-existing movement disorders caused by Prozac. Ask your doctor if Parkinson's is right for you. Gastrointestinal. In the very common side effects of Prozac, 29% experience and report nausea. That's 1 in 3 people will become nauseous. 1 in 5 will develop diarrhea. And then 1 in 10 will develop dry mouth. In the respiratory category, Prozac. In the very common category, 23%, 1 in 4 will develop rhinitis, runny nose allergy symptoms. 1 in 4. A sore throat, inability to talk, pharyngitis, up to 1 in 10. Asthma is a 1% of people will develop asthma. Well, did you know Prozac causes asthma in some people? Now they go into the other category. Some other very common side effects of Prozac are asthenia or fatigue. 1 in 5 will develop fatigue, chronic fatigue. Okay, well, that's a sign or symptom of depression. 1 in 5 will develop just fatigue from just taking Prozac. Up to 10% will develop accidental injuries. They will hurt themselves accidentally. Lethargy, you see that feeling jittery, tinnitus. Anybody want ringing in the ears? 1 in 10 people on Prozac will develop tinnitus, ringing in their ears. Did you know that Prozac is known to cause abortion? Well, if it can cause a fetus to die and make a pregnant woman lose her baby, can it really be healthy for you? Growth delay, another side effect of Prozac. Might want to be careful. This is approved for children. So if you got short children and you want them to be NBA All-Stars one day, you might not want to give them Prozac. Pick something else that doesn't cause growth delay. Anorexia in 17% of all people developed by those on Prozac. Prozac causes anorexia in 17% of all people. Decreased appetite in up to 10% of all people. Increased appetite, weight loss. Did you know Prozac causes arthralgia, pain in your joints and muscles, muscle twitching, arthritis? Did you know that? Genitourinary symptoms of Prozac. Did you know that 11% of all people on Prozac develop decreased libido, a lower sex drive? Did you know up to 10% will experience abnormal ejaculation disorder? I don't know what that means, but I thought you either ejaculate or you don't. So I'm assuming Prozac makes it to where you can't, because look what else Prozac does. It causes erectile dysfunction. Now, anybody out there, women out there, pay attention. If your man is on Prozac, if they lost their job, if they lost an inheritance, whatever, I don't know, lost a child, lost a friend, lost a boss. If they are depressed for more than 2 weeks and they're put on Prozac, being told they're clinically depressed, and then they develop erectile dysfunction, they're going to be told that's a result of their age, and they just need Viagra. No. If they're on Prozac or an SSRI, it directly causes erectile dysfunction in 1 out of 10 men. And then for females, look what it says. Prozac causes gynecological bleeding. How many women have endometriosis and are bleeding nonstop, being told that this is a inherited disorder? They don't know what's causing it. You're just bleeding out. You need a total hysterectomy or a partial hysterectomy. Did you know Prozac causes gynecological bleeding in 1 out of 10 women? Did you know that? Well, now you do. Ask your doctor if gynecological bleeding and ejaculation disorders and erectile dysfunction are right for you when you're depressed for 2 weeks or more. Sign me up for Prozac. Oh, I won't even dive into that. I've read many, many books, published books by journalists who do a lot of research, who have been able to show a lot of proof and evidence that the CIA created Prozac in there to be used as a drug in their MK Ultra mind control programming. Prozac was supposedly made by the CIA to help mind control their MK Ultra experimental humans. And then the FDA approved it and sent it out to all of you. And then they use Operation Mockingbird through our media to brainwash you through harmonics, lyrics, visuals, scenes, you name it. Anyway, imagine if that's true. But I've read enough to be convinced it probably is. All right. Did you know that 12% of people on Prozac will develop the flu? 1 in 10 will develop the flu. Did you know Prozac could cause the flu? And then I ask you, I thought the flu was a virus. Does that mean Prozac has the flu virus in it if 1 in 10 people develop the flu from Prozac? Flu syndrome. That means you had to be diagnosed with the flu because of Prozac. How does that work? 1 in 10 will develop an infection of some sort. And then I want to focus on this next one. Do you guys know what herpes zoster is? Prozac. It is now published. You're looking at it by drugs.com. Very reputable medical review online journal. Do you know the FDA, the package inserts, and drugs.com are all reporting that Herpes zoster is a published side effect of Prozac. Do you know what herpes zoster is? Now, just so you know, the fact that they would even put this online, they know you don't know what herpes zoster is, most of you. Herpes zoster is the virus that is the cause for 100% of all shingles outbreaks. Shingles is herpes zoster. How many of you knew that Prozac causes shingles? Now, my question for you is this. How can Prozac cause 1 in 10 people to get the flu? Like be diagnosed with the flu? And how can any amount of people develop the shingles from Prozac? I thought that was a herpes zoster virus. Does that mean the herpes zoster virus is in Prozac? And is the flu viruses in Prozac? Is it in 1 in every 10 tablets of this stuff? Anyway, do you know anybody who suffers with shingles outbreaks commonly? Did you know Prozac causes it? You might want to find out if they're on an SSRI, and if they are, tell them to get the heck off that drug, because shingles are worse than depression. Yes, I said it. Cardiovascular side effects of Prozac: arrhythmias, congestive heart failure. Did you know Prozac causes congestive heart failure? Anybody out there been depressed, lost a loved one, living in a nursing home, assisted living home? Now you're put on an antidepressant because you lost your spouse of 50 years. Now you're depressed and sad for more than 2 weeks. So now you can be clinically diagnosed as depressed. You can be put on Prozac. And did you know you can be diagnosed with congestive heart failure from Prozac? Did you know it's a published side effect of Prozac, reported by MDs who prescribe Prozac to patients who didn't have congestive heart failure and now do, since they were put on Prozac, and reported that back to the FDA and to the drug company? Do you know how many people have been told in America their congestive heart failure is caused by their antidepressant? Well, there's millions of people on antidepressants like Prozac that are told they have congestive heart failure after, but none of them were told it was caused by Prozac. 100% of them were told it was inherited by their parents or grandparents. Well, now you know Prozac causes congestive heart failure. Amazing. Myocardial infarction, that's a heart attack. Peripheral edema, leg and ankle swelling, arm swelling, hand swelling. Okay, you're going to be told that's a side effect of a insufficient heart working. Prozac causes that, by the way, and is published to do so. For the skin, did you know Prozac can cause acne? Did you know Prozac can cause alopecia, cause you to lose hair? Well, do you think losing your hair from Prozac is going to make you less depressed or more depressed? I don't know. Ask your doctor if alopecia is right for you when you're depressed. Doc, I feel really sad and lonely. I think I'd be better if I lost hair all over my head. Can you prescribe something that does that? I think that'll make me happier. Did you know that Prozac is published to cause 1 in 10 people to develop abnormal vision or blurry vision? Not sure how that helps anybody, except sells more contacts, LASIK surgeries, and glasses. All right, now let's dive into Zoloft. Zoloft is an antidepressant that belongs to a group of drugs called SSRIs, which works by balancing serotonin levels in the brain and nerves. This is what it looks like. Here's your FDA black box warning about Zoloft. Antidepressants increase the risk of suicidal thoughts and behavior in pediatric. Whoa. I don't know about you. If I said the word pediatric, what age range do you think? I think like 0 to 12. Antidepressants, FDA says, increase the risk of suicidal thoughts and actions in pediatric age ranges and young adult patients in short-term studies. Short-term, how long is that? 8 weeks or less, 12 weeks or less. That means you put kids on this thing, man. It doesn't take long if they're on Zoloft to develop suicidal thoughts as pediatric age patients. What? How many pediatricians do you think actually go into practice thinking they're going to be dealing with little children, toddlers, infants who want to kill themselves and are trying to kill themselves? They're trying to reach the knife off the top of the counter that mom was using to cut up steaks. They're trying to grab that to stab themselves and kill themselves because that's what Zoloft is doing to them. And then the FDA says this to every medical doctor. So parents, pay attention. Spouses, pay attention. Closely monitor all antidepressant treated patients for clinical worsening. It doesn't say a few. It doesn't say closely monitor some. It says closely monitor all antidepressant treated patients for clinical worsening and for emergence of suicidal thoughts and behaviors. In the side effects at drugs.com, this is from their package inserts, already reviewed by the FDA. During the clinical trials, 21% of all people on Zoloft experienced insomnia. They couldn't sleep anymore. Well, ask me if that improves depression. It doesn't. It makes it worse. All right, so 1 in 5 will develop insomnia, the inability to sleep all night. Up to 10% of all people on Zoloft. Check out this list. So you're depressed. You're telling how low of life your life is to your MD. And he's like, I think Zoloft is right for you, Mary. I want to read to you, 1 in 10 of you will develop these symptoms. Affect, your facial expressions. Emotional lability. Your whole facial expressions disappear. No smiling, no sadness, just blank. Aggravated depression. Oh, crap. This 1 in 10 will have worsening depression, aggravated depression. Your depression is going to be worse. 1 in 10. Aggressive reactions. Yeah, who doesn't want that in their home and in their marriage or in school when they send their kid off to public school to go play on the recess with all these mean kids? Aggression. Oh, we're just in the A's still. I mean, these are all in alphabetical order. We're still in the A's. Agitation, anxiety. Yeah, being depressed and now anxious is better. Bruxism, teeth grinding, decreased libido. Yeah, let's now make your spouse pissed and depressed because you don't want them anymore. Depersonalization. Oh, that's great. Yeah. Depression is a known side effect in 1 of 10 people on Zoloft. They'll become depressed just because of Zoloft. Nervousness, nightmares, mania. Oh, how's mania better than depressed? How about paranoia? How many of you would like to be paranoid? Ask your doctor if Zoloft is right for you. Suicidal ideation and suicidal attempts. 1 in 10 people on Zoloft experience all of those in the clinical trials. Then you get to the uncommon. 1% of people will develop abnormal dreams, abnormal thinking, and hallucinations. What? Okay, that's hallucinations are bipolarism and schizophrenia. All right, ask your doctor if schizophrenia is right for you when they prescribe Zoloft. Look at rare. You'll see drug dependence, paranoia, psychotic disorders, sleepwalking, suicide behavior, conversion disorder. You should go look up conversion disorder. I did. I didn't even know what that was. All right, now let's keep going. Psychomotor hyperactivity. Psychomotor, psycho is the brain. Motor is your body. Psychomotor hyperactivity. Seizures is a hyperactivity. Involuntary tremors, Parkinson's, that is what that is. Psychomotor hyperactivity, that is an example. Parkinson's tremors. Did you know it's caused by Zoloft? Did you know Zoloft, after the FDA approved it and MD started writing the prescriptions for it, many of them reported back to the FDA, the moment we put our patient on Zoloft for depression, they experienced depressive symptoms. What? Wait, you're telling me they didn't have depressive symptoms when you wrote them an antidepressant prescription? That's weird. Intense dreams, manic reaction, psychosis. Yeah, there you go. Nervous system for Zoloft. 22%, 1 in 5 develop headaches. Okay, remember, I already mentioned this earlier with Prozac. Do you really think headaches make your depression better or make you more depressed? Somnolence, 13%. Dizziness, 12%. I don't think anybody benefits from being dizzy ever. Notice up to 10% of all people on Zoloft during the clinical trials of Zoloft were actually who did not have these before they tried Zoloft, then developed convulsions, tremors, seizures. That's what that means. Did you know that up to 1% of all people on Zoloft, which are millions of people, by the way, are on Zoloft, will develop a speech disorder? Do you know what that's called? Aphasia. Bruce Willis, if you don't know what that is, go look at Bruce Willis, just retired from Hollywood because of aphasia. Did you know that was a side effect of Zoloft? It's also a side effect of cholesterol drugs. Somebody should tell him to get off those drugs and his speech will come back. And then did you know Zoloft has been reported by MDs to make their patients they wrote the prescription for, it made some people go into a coma. Ask your doctor if coma is better than depression. He might think it is. Cardiovascular side effects of Zoloft. Up to 10% of people will experience chest pain, hot flashes, and palpitations. GI symptoms. 26% of you, 1 in 4, will develop nausea. 1 in 5 will develop diarrhea and loose stools. And another 14% of all of you will experience dry mouth symptoms that you will be called Sjogren's. Females. Then look at the bottom. After the FDA approved it, check this out. Did you know Zoloft has been prescribed to people depressed. And when they wrote the prescription, the patient went home and took the Zoloft for the first time. They developed gastrointestinal bleeding from Zoloft. They developed pancreatitis, ended up in the hospital with severe pancreas pain in a fetal position. And did you know that rectal hemorrhaging, bleeding out of your a-hole, is a side effect of Zoloft? Ask your doctor if rectal hemorrhaging is right for you. He might think it is. It might take your mind off of being depressed. All right, skin disorders related to Zoloft. Zoloft causes acne in 10% of all people that take it, 1 in 10. Urticaria, red rashes all over your body. Alopecia in up to 1% of all of you. That is not going to make you feel better. If you start taking any of these SSRIs and your hair starts falling out, stop them right away. You could be one of these people. And then GI tracts. Genitourinary. Genitals, not GI. All right, so 14% of all men will experience ejaculation failure. That is like 1 in 8 will develop the inability to ejaculate. That doesn't help with infertility problems, obviously. Then you'll see ejaculation delay or disorder, erectile dysfunction, vaginal hemorrhage. Oh my goodness. Who in the world? Have you even read the word vaginal hemorrhage before in English on a screen or in an article? Ask your doctor if vaginal hemorrhage is right for you, because up to 10% of all people, females, in the clinical trials for Zoloft started bleeding out of their vagina while on Zoloft, caused by Zoloft. And then how about breast pain? Any females? How many of you would just love their breast hurting? How about cystitis? Oh my goodness. You want to talk about something painful and annoying? Anybody want cystitis? Zoloft will do it. Ocular. This is eyes. 10% of all people on Zoloft in trials experience abnormal vision, visual disturbances, and impairments. Now let's get to Lexapro, one of my least favorite of all the prescription drugs for personal reasons. I had family members put on this for years. It took me 6 months to get them off of this one drug. Holy cow. All right. What is Lexapro? Sorry, I jumped ahead there. Lexapro is an antidepressant from the group of drugs called SSRIs and is used to treat certain types of depression and anxiety. That's a picture of Lexapro. Lexapro also comes with an FDA black box warning. Suicidal thoughts and behaviors. Antidepressants increase the risk of suicidal thoughts and behaviors in pediatric children and young adult patients in short-term studies, meaning this is a 12-week or less study, and still kids in these short studies were wanting to kill themselves, and adults were too. Closely monitor all Lexapro treated patients for clinical worsening. Clinical worsening is worsening depression that you've prescribed it for, and for emergence of suicidal thoughts and behaviors. Well, in a minute, I'm going to walk you through 4 nutrients that are proven to improve all outcomes of depression and have 0 side effects of worsening depression or suicidal ideations. It's going to be amazing. Now, I'm going to go back to the beginning of our podcast. Remember, I did this with Prozac. I went back to the verywellmind.org article where they're telling you the most common SSRIs being prescribed, and I told you I starred them. All right, look at this. This is Lexapro. After we just read the black box warning again, that suicidal ideation and behavior in pediatric age groups goes up when on Lexapro, and closely monitor all the kids you put this on. I want to just show you this. Lexapro is one of the only SSRIs approved by the FDA for children. What? It is indicated for use in children and teens between the ages of 12 and 17 for the treatment of major depressive disorder. What? If this increases suicidal ideation, thoughts of suicide and killing oneself in pediatric age ranges, and suicide behavior, why are we prescribing this to anybody? It should be taken off the market right now, in my opinion. This isn't better than being sad for 2 weeks, which is how you clinically diagnose depression in America. Got to be sad, low in function for 2 weeks. Oh my gosh, what? As if life doesn't really happen. You never wrecked a car, your favorite car, when you were 16 years old. You never wrecked your car and were depressed for 2 weeks. You didn't have a fire in your house and were depressed for 2 weeks. You didn't have a car fender bender you had to worry about for 2 weeks. You didn't have a child with the flu you had to deal with for 2 weeks that was depressing. Couldn't go to work. There's a lot of reasons you can be depressed that are legit. All right, here we go. This is psychiatric Lexapro. What are the psychiatric side effects of Lexapro from clinical trials? Up to 14% of all of you, 1 in 10 will develop insomnia. You can't sleep. Notice that theme? Okay. So anybody out there dealing with insomnia being put on Lunesta or whatever, Ambien, after they were put on these, did you know your insomnia is being caused by these drugs for the depression? Up to 10% will experience abnormal dreams on Lexapro, agitation and anxiety. Notice Lexapro, I just showed you, is prescribed for depression and anxiety. It was the only one that said that of the drugs I've shown so far. But did you know that anxiety can be created in up to 10% of all people from taking Lexapro? Also, abnormal thinking, aggravated depression. So that's worsening depression, aggression, aggressive reaction. That sounds good. Depression caused by Lexapro. Visual and auditory hallucinations are caused by Lexapro. What? That's schizophrenia, man. Obsessive compulsive disorder, SSRIs, which is what this drug is prescribed for obsessive compulsive disorder. Did you know it causes OCD in some people? Panic attack and reactions. Is that better than depression? And that's actually a sign or symptom of anxiety and panic attacks that you use Lexapro for. Did you know Lexapro causes it? So if you have a loved one who has anxiety attacks, panic attacks, depression, and anxiety, and they get on Lexapro, get on Prozac, get on Zoloft, and they have worsening panic attacks and reactions after being put on those drugs, it's not that their condition's getting worse. The drug is making them have these symptoms more frequently, literally. Then what's the fix? You tell your doctor to get off the damn drugs and help you get off them. Paranoia, suicide attempt, and tics. I don't know. Tics sound better to you? Mania, suicidal ideation and behavior, completed suicide is a published side effect after the FDA approved it for millions of Americans to use Lexapro. When medical doctors started writing the prescription, they would give it to them, and then those people would commit suicide from Lexapro, and then the MDs were notifying the FDA and the drug maker. My patient was suicidal before I gave him your drug, and they killed themselves. Non-accidental overdose. Okay. Mood swings, psychotic disorders. How does that sound better than depression? Oh, and just so you know, all of these side effects, I remember having patient after patient after patient who had migraine headaches as their complaint while they went to the MDs. If they couldn't figure out what was causing their migraines, they often would put them on one of these antidepressants. And notice, 1 in 4 of every one of these most commonly prescribed SSRIs has headaches as a published side effect. Now, just so you know, if you're not depressed and you have headaches and they put you on an SSRI, headaches are depressing enough. But remember, these don't address the cause for depression, but they also don't address the cause for headaches. And yet 1 in 4 for each of these drugs are in clinical trials. Headaches were reported in people who never had headaches and were put on these drugs. Headaches do not make the world better or your life or your loved one's life. Somnolence in up to 13% of people. This is Lexapro. Now go down to the bottom. After the FDA approved it and medical doctors started writing prescriptions for Lexapro, many MDs have made the FDA aware and the drug maker for Lexapro that their patients now have convulsions and seizures from Lexapro. They now have grand mal convulsions or seizures where they're flailing all around uncontrollably, and movement disorders. Parkinson's disease is an example of a movement disorder. Metabolic side effects of Lexapro: decreased appetite in up to 1 in 10 people, 10%. Increased appetite or weight increased. Well, would you like to put on weight? Would that make you less depressed? If it would, Lexapro might be right for you. Cardiovascular palpitations in 1 in 10 people. You will develop a heart arrhythmia. You will feel your heart flutter and beat harder than normal because of Lexapro. 1 in 10 of you will. And then look at the 1% of all people. Those are all cardiovascular side effects. But after the FDA approved 10% of people having palpitations from this drug, that wasn't bad. Let's just go ahead and approve it. Let MD start writing the prescription for Lexapro for all these sad people in America who have been sad for 2 weeks for any reason. Do you see what MDs reported back to the FDA and to the drug makers after they wrote the prescriptions? Cardiac failure. Their heart stopped and they died. Hypertensive crisis. Do you know what that is? That's a stroke. tachycardia, arrhythmias, thrombosis, that's a blood clot. Ask your doctor if death is right for you. Okay, here we go. Here's another one. Did you know Lexapro in 10% of all people, 1 in 10 will develop influenza-like symptoms? And notice I highlighted herpes zoster there. You will develop shingles. So I ask you, does Prozac have the flu virus in it? Does Lexapro have the flu in it? Does Lexapro and Prozac have herpes zosters or the shingles virus in it? And then I highlighted bottom left. You can't really see it because there's a red border around the whole thing, but notice underneath there, Lexapro is known to cause parasitic infections. What? How is it possible that Lexapro, an antidepressant, can cause a parasite infection? I haven't even figured that one out yet. Can you figure out how a pill causes a parasitic infection without having the parasite in it? Ask your doctor if worms are right for you. He might think it is. I don't know. GI tract. All right. Did you know 1 in 5 will develop nausea? 14% of you will develop diarrhea and be told you have IBS-D, irritable bowel syndrome, diarrhea. That's what they're going to say. No, you don't. You have Lexapro poisoning. Now, for the skin, increased sweating in 10% of you, which is fine. That's a detoxing thing, unless it's annoying and coming from your palms and hands and feet when you're cold even. And then did you know acne, aggravated psoriasis, and alopecia have been reported as side effects to Lexapro? So if you're developing, do you think psoriasis, plaque all over your body, would help improve your depressive state? And do you think losing your hair or having acne on your face and body improves your depression? If so, ask your doctor if Lexapro prescriptions are right for you. And then they dive into others. Up to 10% of all people on Lexapro in the clinical trials reported fatigue and pyrexia. Do y'all know what pyrexia is? Look it up. Facial edema. Not sure that makes you less depressed. Now look at this. Did you know Lexapro is published that in 1% of all people in the clinical trials had fractured neck of their femur? You know, old people fall, and then they're told they broke their hip. That is not the case. It's almost 100% of the time your hip breaks and you fall as a result. But once you're taken to the hospital, then they can take a picture and see that your hip broke, and they're going to tell you the fall must have broke it. No, that is not what happens. No, you have become osteoporosis, and your hip broke from the weight of your thorax and abdomen standing on top of it, and it shattered. Did you know Lexapro is proven in clinical trials to cause your femur to break? Did you know Lexapro is published to cause tinnitus, ringing in the ears of people? Did you know Lexapro, just so you know, just conceive if somebody's pregnant, is put on Lexapro, it has caused a spontaneous abortion. Do you possibly think that this is a good thing for you to put in your body? Even if you're not trying to be pregnant, even if you don't have a uterus, even if you're not sleeping with somebody, do you really think it's got to be healthy for you if it causes spontaneous abortions? Think about everything at play to kill a baby, detach it from the uterus inside of a female, and make the body abort it. Lexapro did that. Musculoskeletal side effects. Joint pain, muscle pain, back pain, myalgia, muscle pain, aches, shoulder pain, neck pain, and 10% of all of you. Pain does not make people less depressed. Genitourinary, these are your reproductive organs. Ejaculation disorder in 14% of you. Again, ejaculation failure and vaginal bleeding in 10% of all of you. 1 in 10 will develop vaginal bleeding. Ask your doctor if pads, diapers to catch all the blood you might bleed out from Lexapro is right for you. Ask them if your Lexapro prescription comes with the pens. But I want to highlight something. Notice here, they've actually, during the clinical trials, they figured out that a percentage of people had unintended pregnancies from Lexapro. I want you to explain that to me. How does Lexapro create unintended pregnancy? Well, I'll tell you what must have happened. If people are having sex during the trial and are on birth control pills and they still got pregnant, the blame went to the mechanism of action in the body of the female who didn't want to get pregnant, was on birth control, and still got pregnant while on Lexapro. Oh, how about you women out there who hate uterine fibroids, worried about uterine fibroids? Did you know Lexapro for depression causes uterine fibroids in some people to form? In the clinical trials. And the clinical trials are not very long, and everybody on these antidepressants are on them for life. Vaginal candida. Anybody want a smelly vagina? Anybody want to stink up the car or house with a yeast infection vaginally? Did you know Lexapro does that? That's not embarrassing, depressing to think about. Vaginal hemorrhage. Thank you, Lexapro. Psychiatric Lexapro. 14% insomnia, abnormal dreams, agitation, anxiety, nervousness, aggravated depression, feeling unreal. I highlighted that one. Can you explain to me what feeling unreal is? That's a side effect of Lexapro. And up to 1% of all people that take it, and there's millions of people on it right now. In the clinical trials, up to 1% of people reported, I don't feel real. Feeling unreal. I don't feel real. I don't even know how you would describe that. It's got to be good for you, though, whatever that is. Visual auditory hallucinations, Lexapro causes that. Obsessive compulsive disorder, Lexapro causes that. Panic attack reactions, paranoia, thank you, Lexapro. Sleep disorders and suicide attempts are known to be caused by Lexapro. Then the FDA approved it. Then after it went to the masses, into your pharmacy, mania, suicidal ideation and behavior were all reported by MDs to their patients. Not all MDs reported, but MDs had to report this in order for this to make it here. And then more doctors reported acute psychosis. Oh my goodness. Mental detachment, gone crazy. Anger from just Lexapro. Completed suicide because I wrote the prescription for Lexapro. These people killed themselves. Delirium. Delusions. Delusions are thoughts of grandeur, that the government, spies are outside your house trying to get in and kill you, destroy you, kidnap you, sabotage your life by sneaking into your bank account and stealing your money. Disorientation, non-accidental overdose, mood swings, nightmare, psychotic disorder, and withdrawal syndrome. You know, depressed people are withdrawn. Did you know Lexapro causes withdrawal symptoms? Up to 13% of people will be somnolent. They don't engage. They don't have any emotions, it appears. 1 in 4 will develop headaches from Lexapro, amnesia, paralysis, cerebrovascular accident, that's a stroke, convulsions, seizures, grand mal seizures, movement disorders. Hello, Parkinson's again. Oh, hold up. I missed one. Look right in the middle of the screen. Paralysis is caused by Lexapro? Wait a minute. I thought you had to like be in a car wreck or on a motorcycle. Could you imagine just popping a pill you were prescribed that you got at CVS or Walgreens, and then within a few days you were paralyzed? What? Ask your doctor if being paralyzed is right for you. He might think it is. He'll give you something else to complain about, he might think, versus your depression. All right, so here we go. Antidepressants and suicide risk. This is a research journal, Journal of Pharmaceuticals in 2010. Schneeweiss is a medical researcher, and his team conducted a study of users of antidepressant agents in a population of 287,000 adults, and they were aged 18 and older after the initiation of the antidepressant treatment. So after they were given an antidepressant, like I just showed you. And they found rates of suicide behavior ranging from 4 out of every 1,000 persons to 9 out of every 1,000 people put on those drugs. And the majority of events occurred in the first 6 months after the treatment started. Remember all those suicidal ideations in young people, pediatrics, in a short-term studies? The majority of people who tried to kill themselves or had suicidal thoughts, it occurs in the first 6 months they're on that drugs. Please, for the love of God, listen to me. The FDA even says, medical doctors, make sure you closely monitor anybody you put these drugs on. Well, I'm going to tell you right now, for the first 6 months, you better be closely watching mom, dad, spouse, medical doctor. Oh, teachers. Compared with selective serotonin reuptake inhibitors, SSRIs, like we just walked through, Zoloft, Prozac, and Lexapro, serotonin, no norepinephrine reuptake inhibitors, SNRIs, tricyclic agents, and other newer agents showed a similar risk. Ask your doctor if suicidal ideation is right for you and your children. So disgusting. People that are depressed don't want to live, man. Come on. Why would you give them something that makes and is known to increase your risk of not wanting to live and take action to end it. A few of these studies found greater suicidal risk with more antidepressant treatment in general. So the more antidepressants you're on, the longer you're on them, the worse it gets. Specifically with the greater use of SSRIs and other modern antidepressants. So SSRIs, the more people use, the higher the rates are reported of suicide. By age group, pay attention everybody, they found small increases among adolescents, small increases in suicidal rates, and larger increases in elderly patients, but fewer completed suicides and more attempts. Less people actually completed their suicide attempt when they were elderly, probably because they were tremoring as they were trying to cut their veins and they were missing it. So fewer completed suicides, but more attempts to kill themselves in the elderly. They tried harder than the younger. They just couldn't do it. They weren't strong enough to kill themselves physically. All right. Well, here we go now. Time to dive into the research about what it is Dr. Ardis recommends to deal with depression naturally. Here we go. So if you're depressed, here we go. This is the Tropical Journal of Pharmaceutical Research. Urinary iodine, so they're going to measure how much iodine is coming out of their urine, and vitamin D are associated with depression in adolescents. So the amount of iodine being lost in their urine and their blood level, serum is the word, serum vitamin D levels, are associated with depression in adolescents. All right, great. So we know it's not a Prozac, Zoloft, Lexapro deficiency causing pediatric age children to be depressed. We know that. However, you're about to learn something about iodine and vitamin D. A total of 270 adolescent participants from ages 8 to 16 years old were enrolled in this study. They tell you it was 125 males, 145 females. Of these, 160 participants were diagnosed with depressive disorder. Then they tell you that vitamin D levels less than 15 nanograms was considered as vitamin D deficient, and iodine less than 100 nanograms per liter was viewed as iodine deficient also. The average vitamin D and iodine levels were compared between the depressed group and the healthy adults or adolescents that were not depressed. So depressed disorder patients had lower concentrations of vitamin D in their blood and their urinary iodine input than non-depressive disorder control patients in both the male and female groups. So the lower iodine in their urine, the lower vitamin D in their blood, the worse they were more often diagnosed as depressed. However, blood levels of vitamin D concentration did not significantly correlate with their depressive symptoms, so they couldn't find a range of vitamin D that really correlated to it. Adolescents with depressive disorder have markedly lower, remarkably, it's very noticeable when we're tracking it, they have much lower vitamin D concentrations in their blood, and their urinary, what they're peeing out as far as iodine levels, are lower than in the control groups, meaning they must have lower iodine in their body. This relationship is positively associated with disease progression. What's the disease they're talking about? Depression, suggesting possible nutritional intervention measures for neuroprotection. All right, let's just put it in English. Vitamin D levels and iodine levels in your body of children is directly correlated to you being depressed as a child. The lower those levels of iodine and vitamin D, the more often you're going to have depressed children. Now, the hidden link, this is from Supreme Specialty Hospitals. This is an article titled The Hidden Link Between Iodine Deficiency and Mental Health. And we're just going to highlight stuff on depression. How iodine deficiency impacts mental health section. Iodine deficiency has significant effects on cognitive function, mood regulation, and mental health, impacting both children and adults. Low iodine levels, which lead to hypothyroidism, are linked to reduced IQ. We talk about it all the time here at the Dr. Ardis Show. Iodine, selenium, and L-tyrosine for thyroid markers and making thyroid hormones. So you see here, low iodine levels, which leads to hypothyroidism, are linked to reduced IQ, slower reaction times, and developmental delays in children, while also causing memory issues, brain fog, and difficulty concentrating in adults. Beyond cognitive impairment, iodine deficiency can trigger depression, which is what we're talking about today. Iodine deficiency can trigger depression, persistent fatigue, and emotional instability, with individuals experiencing mood swings, irritability, and anxiety due to the body's reduced thyroid hormone production. The body needs iodine to make thyroid hormones. This is especially critical during pregnancy and early childhood. What? They talk about postpartum depression, prenatal depression. Oh, this is especially critical during pregnancy. Pregnant women, you should probably be on iodine. In early childhood, when iodine is essential for brain development and neural growth. Without adequate iodine, children may face developmental delays, lower IQs, and in severe cases, conditions like cretinism, which is actually just hypothyroidism in children. Low iodine levels. All right, so that's iodine. Now I want you to see the connection to iodine, children's mental health, and depression. Now we're going to go to the next vitamin. This is vitamin D. Vitamin D protects against depression. We just highlighted in that previous research study the iodine and blood levels of vitamin D. This is only vitamin D. Vitamin D protects against depression. Evidence from an umbrella, a whole bunch of overlooming analysis of different research studies. Vitamin D supplementation was efficient in alleviating symptoms of depression. Not Prozac, not Zoloft, not Lexapro. Vitamin D supplementation was enough in alleviating symptoms of depression. And an inverse association was observed between higher levels of vitamin D intake and overall depression. The more vitamin D, the lower depression scores. Based on subgroup analysis, vitamin D supplementation in studies using dosage of higher than 5,000 IUs a day, which is exactly what our dose of vitamin D3K2 is, and intervention duration of just 20 weeks exhibited stronger effects in lowering the symptoms of depression. 20 weeks of vitamin D, just do it every day you need it. Moreover, the inverse association between lower blood levels of vitamin D and depression was stronger among participants aged less than or equal to 50 years old. So children, teenagers, anyone younger than 50, there was a much stronger correlation to the amount of vitamin D and their depression. Recent studies have shown a significant association between vitamin D insufficiency or deficiency and depressive disorders. Dr. Ardis is not the one making this up. I'm reading you medical peer-reviewed research studies and published. Vitamin D is involved in the synthesis of neurotropic factors and neurotransmitters in the brain, chemicals that make your brain work normal, which include these. Look, serotonin, your happy feel-good hormone, which is what SSRIs are prescribed to try to block absorption of. Dopamine, Parkinson's, anybody? Adrenaline and noradrenaline through VDRs in the adrenal cortex. And due to its steroidal structure, vitamin D, it modulates the hypothalamic, a part of your brain, pituitary, adrenal axis, balancing all your hormones, and GABA receptors, which, if you don't know what GABA is, go check it out. This elevates the mood, people. During depression, inflammatory markers increase. When you're depressed, inflammation goes up. Meanwhile, vitamin D displays antioxidant effects, reduces inflammation in the central nervous system, and it enhances nerve growth factors and the gene expression of antioxidant agents. It downregulates inflammatory markers called cytokines, which were commonly talked about during COVID in the lungs, cytokine storm, and inflammatory mediators such as nuclear factor kappa beta, which is linked to psychosocial stress and depression. You're welcome. Ask your doctor if vitamin D is right for you if you feel low for 2 weeks. That's funny. And true. The conclusion of this vitamin D study in depression, the present umbrella meta-analysis confirms the potential benefits of vitamin D supplementation in reducing symptoms of depression and an inverse relationship between higher blood levels of vitamin D and overall depression. Vitamin D supplementation in studies using dosages higher than 5,000 international units a day. I always recommend 5,000 to 10,000 a day. And intervention duration of up to at least 20 weeks exhibited better effects in lowering depression symptoms. We are now going into the fall and winter months. This is the sad period, seasonal affective disorder, where you're depressed because sun is low, no real vitamin D levels. You should be taking way more vitamin D during the fall and winter months. So do 2-dropperfuls of our vitamin D3K2. Now, speaking of K2, sorry, I jumped ahead. This is Frontier Nutrition. Frontiers in Nutrition. Medical Journal, online, 2023. Association between vitamin K intake and depressive symptoms in the United States adults. Data from the National Health and Nutrition Examination Survey from 2013 and 2018. We're looking at humans in America. They're going to reference a few animal studies here, which is why they're doing this. An animal study observed that vitamin K deficiency due to dietary depletion, not taking it supplemented, or by warfarin. If you're on a blood thinner called warfarin, it lowers vitamin K absorption. Vitamin K is responsible for blood clotting, so warfarin blocks vitamin K absorption. Was associated with hypoactivity and a lack of exploratory behavior in rats, which they call depression in rats. In addition, researcher named Turker and his team found a significantly higher frequency of depression during the treatment of patients with atrial fibrillation using warfarin, a vitamin K antagonist. It blocks vitamin K absorption. So those on warfarin had a much higher, lower levels of vitamin K. Okay. The likelihood of depressive symptoms decreased continuously across the entire distribution of vitamin K intake levels. It didn't matter what vitamin K amount you took, depression dropped continuously across the entire distribution of vitamin K. Participants in the highest amount of vitamin K takers in this study had nearly half the odds of depression symptoms compared with those in the lower quartile. So what they're doing is they're taking 4 groups of people, typically a quartile. They'll give like 25 milligrams to one group, 50 milligrams, 75 and 100 milligrams. And then they'll go, great, you take these and we'll just see which one of these quartiles respond to different. They're telling you the more vitamin K group had the least odds of developing any depressive symptoms. The more vitamin K, the better for depression. All right, so we've talked about iodine, a mineral. We've talked now about 2 vitamins, which I mentioned earlier. Now we're now to what's called a bioflavonoid. I called it an herb later. It's not an herb. It's actually found in fruits, but it's called a bioflavonoid. Picture any colorful fruit, vegetables, eggplants, citrus fruits. Inside those very colorful fruit skins is what's called bioflavonoid, and one of them is called quercetin. Therapeutic potential of quercetin in depressive symptoms, a systemic review of clinical studies. Samad, a medical researcher, and his team reported that quercetin can prevent stress-induced anxiety and depressive-like behaviors, as well as improve memory in male mice. And I repeat here, the reason why we study drugs in mice before we give them to humans, I repeat, and I quote, mice have the same genes that human beings do. Therefore, they know if we put a drug in a mouse, if it happens in a mouse, it's going to happen in a human. I'm quoting. That's why all drugs are given to mice before they go to human trials. All right, so they're telling you here, they found a direct correlation that quercetin prevented anxiety and depression in memory and as well as improved memory in these different male mice in their study. In addition, another researcher, Anjanio Liu and his team, their research on the antidepressant activity of quercetin in diabetic rats showed that quercetin reduced immobility time in a dose-dependent manner, which was similar to the effect of the antipsychotic drug fluoxetine. Y'all remember which one that is? That's Prozac. And another antidepressant called imipramine, which is not as common. Moreover, the antidepressant and anxiolytic-like effects observed in quercetin-treated animals in our study are consistent with the findings of another group of researchers named Sameha Morzog, who reported that quercetin alleviated drug-induced anxiety-like behaviors and motor dysfunction in the open field and elevated plus maze test, except for vertical exploration in mice. So going up, that didn't really make improvements, but everything else they test animals on, it improved it. This current study on quercetin significantly increases the level of glutathione-stimulating hormone, which is a most powerful antioxidant your cells in your body and liver make, superoxide dismutase, and CAT in animals, and decreases the levels of MDA, which creates inflammation and disease, tumor necrotic factor A, interleukin-6, interleukin alpha-1 beta, and these are all inflammatory markers. Quercetin reduces inflammation overall. The anti-inflammatory and antioxidant effects of quercetin may be one of the most important mechanisms underlying its antidepressant effects. Many studies suggest that anti-inflammatory effects of quercetin may help alleviate neuropsychiatric symptoms. Neuropsychiatric would be schizophrenia, bipolarism, hallucinations, delusions, OCD, you name it. Another researcher named Sa and his team demonstrated that quercetin significantly reduced the levels of interleukin-1 beta and interleukin-6 in rats treated with lipopolysaccharides, LPS, thereby improving anxiety-like symptoms. Remember, if it happens in those mammals, it's going to happen inside of you. Due to the presence of both catechol and hydroxyl functioning groups in its molecular structure of quercetin, quercetin can directly exert antioxidant effects. If you have inflammation in your body, quercetin turns it down. One study found that quercetin had a significant effect on the perimenopausal depression rat model, as quercetin treated rats significantly increased glutathione stimulating hormone levels in the brain and reduced the level of the oxidative stress marker MDA. We talk about this at length. Selenium is required for the liver to make glutathione. Quercetin also stimulates the liver to make glutathione. This study demonstrates that quercetin significantly increases BDNF levels. Now, this might sound real technical, but I could not leave this out. You're not going to have a definition for this stuff, but stay with me. You will as I read these highlighted statements about quercetin and depression. This study demonstrates that quercetin significantly increases BDNF levels. Please don't try to figure out what that is, and decreases CORT levels in animals, further supporting the biological basis of its antidepressant action. So by quercetin increasing BDNF levels, whatever that is, you're about to learn, and it's decreasing of CORT levels, which you don't know what that is yet either. It's in the next sentences. This explains to the researchers quercetin's antidepressant behavior. BDNF is a protein abundantly present in the human brain, which plays a critical role in protecting dendrites and axons. These are the nerves in your brain, promoting synaptic plasticity, communication continuing between cells in your brain, and regulating nerve survival and intra-nerve cell signaling pathways. Clinical studies have shown that BDNF levels that went up with quercetin are significantly reduced in patients diagnosed with major depressive disorders, the most common form of depression, which we've already discussed. Clinical studies, medical studies have already confirmed that BDNF levels are significantly lower in patients who are diagnosed with major depressive disorder. But read the first sentence up above. This study demonstrates that quercetin significantly increases BDNF levels. Ask your doctor when they tell you you're depressed if quercetin is right for you. Furthermore, existing studies have demonstrated that quercetin and its derivatives may exert neuroprotective effects by interacting with NMDA receptors. You should go look that up and study those, thereby reducing neuronal hyperexcitability and damage. Additionally, the modulation of NMDA receptors by quercetin could help restore neurotransmitter balance, acetylcholine, etc., serotonin, dopamine balance, and destroy depressive-like behaviors. Ameliorate means to get rid of, destroy, eliminate. Eliminates depressive-like behaviors. Here's another study, The Frontiers in Pharmacology, meaning the study of drugs. Imagine that. In the Study of Drugs journal, 2022 is a titled research study, Antidepressant Potential of Quercetin and its derivatives, they call glycoside derivatives. A comprehensive review and update. Antidepressants possibly exert their effects by protecting mature nerve cells in the brain and increasing growth of nerve cells in the hippocampus part of the brain. The protection of mature neurons in the hippocampus is based on the improvement of the HPA, that stands for hippocampal, pituitary, adrenal. Sorry, almost messed that up. Axis dysfunction, hormone regulation, reducing inflammatory states and antioxidant stress, while the increase of new nerve cells in the hippocampus includes direct and indirect effects similar to quercetin. Additionally, foods with quercetin and its derivatives as main ingredients, such as onions and Hericium perforatum, an herb, are readily available in daily life and have been demonstrated to have antidepressant effects. Did you know onions do that? Yeah, one way onions help is if you eat them, it keeps people from wanting to smell your breath who might be toxic people to you, and you'll be less depressed if they come hanging around. Now, for summary, in this research article, they actually show you quercetin in a capsule form being taken by a human. And when you look to the right, you'll see in blue, it says HPA axis, hippocampal, pituitary axis. You'll see it depresses. You'll see it decreases the actions there. And then you will see, so it helps to modulate that, and you'll just see down the list. It helps to reduce inflammation, reduces oxidative stress, and how it does it. It increases neurotransmitter levels, increases neuroplasticity, how the brain works and functions and recalls information, and increases cell regeneration, leading to a depressed person now being happy. So if you want to know how quercetin works, this is what they know. So ask your psychologist or psychiatrist if quercetin is right for you. Overall, the antidepressant effects of quercetin and its derivatives have been demonstrated by a large number of studies, not a couple, a large number of studies. And the related mechanisms have been continuously explored and researched. After improving the studies regarding relevant mechanisms and safety, drugs, prescription drugs, by the way, they're telling you prescription drugs based on quercetin and its derivatives can become the main components during depression treatment. Hold on. Why don't you just let people know they can just swallow quercetin supplements or take the herb and make a tea out of it? Come on. Or the bioflavonoids. You don't need a drug, man. But this is why they're researching plants. They want to know what's in this stuff that helps lower depression. Now maybe we can make new depression drugs by synthetically making our own quercetin derivatives. That's what they're talking about. All right, we discussed the one mineral that we wanted to highlight here today is proven to be low in adolescents and children who are facing depression, major depressive disorder, the most common form of depression. Here's iodine and its connection to hypothyroidism and depression. We get it from kelp. I love it from plants. Quercetin Plus. This is our quercetin supplement. There you go. Here's our D3K2. 3 supplements that contain the 4 different nutrients that are published to know. And you'll see there vitamin D levels at 5,000 IUs. That means if you do, you'll see there's 17 drops. It's 5,000 IUs. Just, this thing tastes delicious, by the way. There's no taste to it whatsoever. If you do 2 dropperfuls, 2 17 drops, that would give you the 10,000 IUs we're recommending. Now, for depression, there are 2 things I want all of you to know. Not only do you need to listen to the Dr. Ardis Show, you need to go read Dr. Bradley Nelson's book, The Emotion Code, and start learning how to release stored, trapped emotions in your subconscious that are making you depressed for longer than 2 weeks at a time. Read that, study it, learn how to do it, and apply that in your life. You'll probably become an Emotion Code certified practitioner, just like I became years ago. Then Feelings Buried Alive Never Die by Carol Trueman. Your emotions, your experiences in life, how you have personally felt. Those feelings never leave unless you learn how to process them. You should start to grasp, not only is there a nutritional component to emotions, depression, and all depressive disorders, you need to know emotional stress alone can lead to every depressive disorder. So I have studied Feelings Buried Alive Never Die, and I've used it in my practice every day I was in practice. The Emotion Code I use every day of my life with all my kids, my wife, myself. Even their boyfriends, girlfriends, all of them. I do it with everybody. It is an incredibly useful tool that helps me stay high in life versus low and depressed. Remember, you can scan our QR code. This is our presentation. Natural Solutions to Depressive Disorders. And then this is our new book. Don't forget it. And just so y'all all know, the depressive disorders we mentioned here, schizophrenia, PTSD, anxiety, bipolarism, SAD, all of them. I write about them in this book because they're all now diagnosable long COVID diseases. And I walk you through all audiences what is found in every patient's blood work, urine, and feces that did cause every psychological and physical symptom in the human body that people now call long COVID, including schizophrenia and depression. So if you want to know what those antidotes are for all of those, that's the book. Scan the QR code. It's still an Amazon bestseller over a year later, which we're all very excited about. So, all right. I am Dr. Brian Ardis. That is our presentation today on depression. I hope you have an incredible, blessed holiday season with you and your family, and may you find ways to naturally bring your mood, your experience, and the way you see life to a higher vibration and frequency, because no one, I believe, deserves to be depressed for very long. But there's always reasons to be sad, always reasons to be low, but you do not have to stay there, and you definitely don't need to be a victim to the horrific side effects that are published to be caused by the most commonly prescribed drugs to everyone in America struggling with depression and abroad. I'm Dr. Ardis. God bless you. We'll see you next time on the Dr. Ardis Show. Thanks for watching this week's episode. Visit thedrardisshow.com/follow for my official social media channels and free healing resources. Beware of fraud accounts. Neither I nor my company will ever ask you for money, crypto, or personal information through your social media or DMs. Like this video and share with a friend. And if you're not already, subscribe and follow along so you don't miss any updates from me, the only real Dr. Brian Ardis. And remember, nature always wins.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.